The science behind aspirin, from willow bark to preventing heart attacks. Introduction. Aspirin is one of the most widely used over-the-counter pain relievers. It is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking the production of prostaglandins, which are chemicals that contribute to inflammation and pain in the body. In this video, we will explore the science behind aspirin, from its origins in natural remedies to its modern-day uses in preventing heart attacks. Body. Aspirin's origins can be traced back to ancient Egypt, where willow bark, which contains salicylic acid, was used to treat pain and fever. Salicylic acid is the active ingredient in aspirin, and it wasn't until the 19th century that scientists discovered how to synthesize it into a more effective form. However, it's important to note that aspirin was not originally developed as a pain reliever. It was initially used as a treatment for rheumatic fever, a condition that causes inflammation and fever. Later on, it was found to be effective for pain relief and became widely used for that purpose. Aspirin's benefits don't stop at pain relief, however. It is also used as a blood thinner and is prescribed to prevent blood clots that can cause heart attacks and strokes. Aspirin works by inhibiting the COX enzyme, which is involved in the production of thromboxane A2, a chemical that promotes clotting. By preventing the formation of blood clots, aspirin can reduce the risk of heart attacks and strokes. In addition to its blood-thinning properties, aspirin has been shown to have anti-cancer effects. Studies have found that regular aspirin use can reduce the risk of certain types of cancer, including colon, breast, and lung cancer. Aspirin works by blocking the COX enzyme, which can promote the growth of cancer cells. Conclusion. Aspirin is a remarkable drug that has come a long way from its origins in natural remedies. It is now widely used as a pain reliever, blood thinner, and cancer preventative. As with any medication, it is important to follow the recommended dosage and talk to your doctor before taking aspirin, especially if you have a history of bleeding disorders or are taking other medications.